Hello everyone and welcome to our channel. Today, we're going to discuss a health issue that affects millions of older adults across America, joint conditions and how to effectively manage them. According to the latest data from the Centers for Disease Control and Prevention, the prevalence of arthritis increases dramatically with age. While only 3.6% of adults between 18 to 34 years old have diagnosed arthritis, this number rises to a staggering 53.9% for those 75 and older. A national poll on healthy aging revealed that 3 in 5 adults aged 50 to 80, 60%, have been diagnosed with some form of arthritis, with osteoarthritis, often called wear and tear arthritis, being the most common type, affecting 30% of older adults. These joint conditions don't just cause pain, they significantly impact quality of life, mobility, and independence. They can make everyday activities like getting out of bed, preparing meals, or even holding a grandchild incredibly challenging. But here's the good news: there are many effective approaches to managing joint conditions that can help maintain your quality of life and keep you doing the activities you love. Whether you're dealing with joint pain yourself or caring for someone who is, this video will provide practical, evidence-based strategies to help navigate the challenges of arthritis and related conditions. So let's dive in and explore how we can better understand and manage joint health as we age. Part 1: Understanding joint conditions in older adults. Let's start by understanding the common joint conditions that affect older adults. Knowledge is power, and understanding your condition is the first step toward effective management. Common types of joint conditions. Osteoarthritis, OA. Osteoarthritis is the most common joint condition among older adults. It's often called wear and tear arthritis, though we now know it's more complex than just wearing down of cartilage. According to the World Health Organization, osteoarthritis is a significant contributor to disability worldwide. About 70% of people with osteoarthritis are over 55 years of age, and with our aging population, these numbers are expected to increase globally. What happens in osteoarthritis? The protective cartilage that cushions the ends of your bones wears down over time. This causes bones to rub against each other, leading to pain, stiffness, and reduced function. The knee is the most commonly affected joint, followed by the hip and hand. Rheumatoid arthritis, RA. Unlike osteoarthritis, rheumatoid arthritis is an autoimmune condition where your immune system mistakenly attacks the lining of your joints. It typically causes symptoms such as tender, warm, swollen joints along with fever, fatigue, and loss of appetite. RA can affect any joint but commonly starts in the smaller joints of your hands and feet. It typically affects joints on both sides of your body equally. While it can occur at any age, many people are diagnosed between ages 40 and 60, and women are 2 to 3 times more likely to develop RA than men. Gout. Gout is another form of inflammatory arthritis that can cause sudden, severe attacks of pain, swelling, redness, and tenderness in joints. It most commonly affects the joint at the base of the big toe. Gout occurs when urate crystals accumulate in your joint, causing inflammation and intense pain. These crystals form when you have high levels of uric acid in your blood, which can happen for various reasons including diet, genetics, and certain medications. Common symptoms of joint conditions. While each condition has its unique characteristics, they share several common symptoms. Pain in the affected joints, especially during or after movement. Stiffness, particularly in the morning or after periods of inactivity. Swelling and warmth around the affected joint. Reduced range of motion and flexibility. Grinding sensation or crackling sound, crepitus, when using the joint. It's important to note that joint pain isn't an inevitable part of aging. As Dr. Brett Smith, a rheumatologist, points out, pain is more common as we age, but not necessarily a fact of life. If you're experiencing persistent joint pain or stiffness, it's crucial to consult with a healthcare provider for proper diagnosis. Early diagnosis and treatment can help manage symptoms and potentially slow disease progression. Understanding your specific condition will help you work with your healthcare team to develop the most effective management strategy. In the next section, we'll discuss how these conditions impact daily life and what that means for older adults. Part 2, Impact of Joint Conditions. Now that we understand the different types of joint conditions, let's explore how they impact the daily lives of older adults. These impacts go far beyond just physical pain. Effects on quality of life. Joint conditions can significantly affect everyday activities and independence. According to a national poll on healthy aging, among those with joint pain, 45% experience symptoms every single day. Nearly half, 49%, report being limited in their usual activities due to joint pain, and 36% say that joint pain interferes with their day-to-day life. For many older adults, this means difficulty with getting in and out of bed, walking up and down stairs, opening jars or containers, driving a car, performing personal care activities like bathing or dressing. Recent studies show that about 1/4 of adults with arthritis experience severe joint pain, rated as 7 or higher on a scale of 0 to 10. This level of pain can be debilitating and make even simple tasks challenging. Psychological and social impact. The effects of joint conditions extend well beyond physical limitations. Mental health challenges. Depression and anxiety are common in people with chronic joint pain. The constant presence of pain can lead to frustration and mood changes. Sleep disturbances caused by pain can further impact mental well-being. Social isolation. Difficulty getting around may lead to less social interaction. Having to decline activities with family and friends. Reduced participation in hobbies and community events. Loss of independence. Needing to rely on others for basic tasks. Potential changes in living arrangements. Reduced ability to care for oneself. Financial impact. Medical expenses for treatments and medications. Potential loss of income if still working. Costs for assistive devices and home modifications. One particularly concerning aspect is the cycle of pain and inactivity. When joints hurt, many people naturally avoid movement, which can lead to muscle weakness. This weakness then puts more stress on joints, potentially worsening the condition and creating a vicious cycle. Despite these challenges, it's important to remember that with proper management, many people with joint conditions can maintain fulfilling, active lives. In fact, proactive management can help break the cycle of pain and inactivity. In the next section, we'll discuss non-medication approaches that can help manage joint conditions and improve quality of life. Part 3, Non-medication management approaches. While medications play an important role in managing joint conditions, there are many effective non-medication approaches that can significantly improve symptoms and quality of life. These approaches are especially valuable for older adults who may be taking multiple medications for other conditions. Appropriate exercise. Despite what many people believe, exercise is one of the most effective treatments for joint conditions. According to the World Health Organization, exercise can strengthen the muscles around affected joints and help improve mobility. The key is choosing the right types of exercise. Low-impact aerobic activities. Walking, start with short distances on flat, even surfaces. Swimming and water exercise, the buoyancy of water reduces pressure on joints. Stationary cycling, provides cardiovascular benefits with minimal joint stress. Elliptical machines, offer a good workout with less impact than running. Strength training. Using light weights or resistance bands to build muscle around affected joints. Start with 2 to 3 sessions per week with rest days in between. Focus on proper form rather than the amount of weight. Flexibility and balance exercises. Gentle stretching, helps maintain range of motion. Tai Chi, research shows it can reduce pain and stiffness while improving balance. Yoga, modified poses can improve flexibility and strength, look for chair yoga or senior yoga classes. Remember to start slowly, especially if you haven't been active. Even 10 minutes of gentle movement can provide benefits. The goal is to gradually increase duration and intensity as your body adapts. It's normal to experience some muscle soreness when beginning an exercise program, but sharp or increased joint pain is a sign to modify your approach. Working with a physical therapist can help you develop a safe, effective exercise program tailored to your specific needs. Weight management. Maintaining a healthy weight is particularly important for joint health, especially for weight-bearing joints like the knees and hips. Each pound of excess weight puts about 4 pounds of extra pressure on your knees when you walk. This means losing even 10 pounds can reduce 40 pounds of pressure on your knees, potentially reducing pain and slowing joint damage. Approaches to healthy weight management include setting realistic, gradual weight loss goals, 1 to 2 pounds per week. Focusing on portion sizes and balanced nutrition. Combining dietary changes with increased physical activity. Seeking support from healthcare providers or weight management programs. Nutrition. While no diet can cure arthritis, certain nutritional approaches may help manage inflammation and support joint health. Anti-inflammatory foods. Fatty fish rich in omega-3, salmon, mackerel, sardines. Colorful fruits and vegetables, berries, leafy greens, bell peppers. Nuts and seeds, walnuts, flax seeds, chia seeds. Olive oil. Whole grains. Foods to limit. Highly processed foods. Added sugars. Excessive alcohol. For some people with gout, foods high in purines, organ meats, some seafood. As Dr. Elena Skyapou, a rheumatology professor at the University of Michigan, recommends, a healthy diet includes fresh fruits and vegetables and cooking from scratch to avoid processed foods. It's time-consuming, but we must invest in our health, including our joint health. Proper rest and sleep. Quality sleep is crucial for managing joint conditions, as poor sleep can worsen pain and increase inflammation. Sleep problems are common in people with joint pain, creating a vicious cycle where pain disrupts sleep, and poor sleep worsens pain. Breaking this cycle requires attention to sleep hygiene. Maintain a consistent sleep schedule. Create a comfortable sleep environment, supportive mattress and pillows. Develop a relaxing bedtime routine. Limit screen time before bed. Manage pain before bedtime, timing medications appropriately, using heat or cold therapy. Mind-body approaches. The connection between mind and body is powerful when it comes to pain management. Stress management techniques. Chronic stress can increase inflammation and pain sensitivity. Meditation and deep breathing can help reduce pain perception. Cognitive behavioral therapy helps develop coping strategies for pain. Acupuncture. Some studies show benefits for osteoarthritis pain. These non-medication approaches work best when combined and tailored to your specific needs and preferences. In the next section, we'll discuss medical treatments and interventions that can complement these lifestyle approaches. Part 4, Medical Treatments and Interventions. While lifestyle approaches are essential, medical treatments often play a crucial role in managing joint conditions effectively. Let's explore the medical options available for older adults with joint conditions. Medication options. Several types of medications can help manage joint pain and inflammation. Over-the-counter pain relievers. Acetaminophen, Tylenol often recommended as a first-line treatment for mild to moderate joint pain, especially for osteoarthritis. It helps reduce pain but does not address inflammation. Non-steroidal anti-inflammatory drugs, NSAIDs medications like ibuprofen, Advil, Motrin, and naproxen, Aleve, help reduce both pain and inflammation. However, they should be used cautiously in older adults due to potential side effects including stomach irritation, kidney problems, and increased cardiovascular risk. Prescription medications. Prescription-strength NSAIDs, higher doses of anti-inflammatory medications that require a doctor's prescription. Duloxetine, Cymbalta originally developed for depression, this medication can also help manage chronic joint pain. Disease-modifying antirheumatic drugs, MARDs for inflammatory conditions like rheumatoid arthritis, these medications target the underlying immune system dysfunction. Biologics, Advanced treatments for inflammatory arthritis that target specific parts of the immune system. Corticosteroids, powerful anti-inflammatory medications that can be taken orally or injected directly into painful joints to provide temporary relief. It's important to note that all medications come with potential risks and benefits that should be carefully considered, especially for older adults who may be taking multiple medications for other conditions. Advanced treatment options. For those who don't get sufficient relief from medications and lifestyle changes, several advanced treatment options are available. Joint injections. Corticosteroid injections provide temporary relief by reducing inflammation in the joint. Viscosupplementation, injections of hyaluronic acid into the joint, particularly the knee, to improve lubrication and cushioning. Platelet-rich plasma, PRP uses concentrated platelets from your own blood to potentially stimulate healing and reduce inflammation. Surgical interventions. When conservative treatments don't provide adequate relief, surgical options may be considered. Arthroscopy, minimally invasive procedure to repair damaged cartilage or remove loose fragments. Osteotomy, realigning bones to shift weight away from damaged portions of the joint. Joint replacement surgery, replacing damaged joint surfaces with artificial components, most commonly performed for hip and knee joints. Joint replacement surgery can significantly reduce pain and restore movement for those with severely affected joints. These procedures have become increasingly advanced and effective, with many patients experiencing dramatic improvements in quality of life. Physical therapy and rehabilitation. Physical therapy plays a vital role in managing joint conditions and should be considered an essential part of treatment. Benefits of physical therapy. Expert assessment of joint function and movement patterns. Customized exercise programs to address specific weaknesses. Hands-on techniques to improve mobility and reduce pain. Education on proper body mechanics and joint protection. Guidance on using assistive devices effectively. A physical therapist can help you. Strengthen the muscles around affected joints. Improve range of motion and flexibility. Learn how to modify activities to reduce joint stress. Develop strategies to maintain independence. Recover more quickly after surgeries or flare-ups. Many insurance plans, including Medicare, cover physical therapy services when prescribed by a doctor. Some plans may limit the number of sessions, so it's important to check your coverage. Complementary and alternative treatments. Some people find additional relief through complementary approaches. Acupuncture, fine needles inserted at specific points may help relieve pain. Massage therapy can reduce muscle tension around joints and improve circulation. TENS units, transcutaneous electrical nerve stimulation devices deliver mild electrical currents to interfere with pain signals. Topical treatments, creams, gels, and patches containing ingredients like capsaicin, menthol, or NSAIDs. While scientific evidence varies for these approaches, many people find them helpful as part of a comprehensive management plan. The most effective treatment plans typically combine multiple approaches tailored to the individual's specific condition, symptoms, and preferences. Regular communication with your healthcare team is essential to adjust your treatment plan as needed. In the next section, we'll discuss how to adapt your home environment to better manage joint conditions. Part 5: Home Support Strategies. Making your home environment more joint-friendly can significantly improve your comfort and independence when living with joint conditions. Let's explore practical modifications and strategies you can implement at home. Adapting your living environment. Creating a safer, more accessible home environment can reduce joint strain and prevent falls. Remove hazards and obstacles. Clear walkways of clutter, loose rugs, and electrical cords. Ensure good lighting throughout your home, especially on staircases. Consider adding motion-activated night lights for safer nighttime navigation. Secure or remove loose carpeting and area rugs, or use non-slip backing. Bathroom modifications. Install grab bars near the toilet and in the shower/tub. Use a shower chair or bench for seated bathing. Consider a raised toilet seat to reduce stress on knees and hips. Use non-slip mats in the shower and bathroom floor. Consider a handheld shower head for greater control. Kitchen adaptations. Rearrange frequently used items to shelves between waist and shoulder height. Use easy grip utensils with larger handles. Consider electric can and jar openers. Use a wheeled cart to move items rather than carrying them. Consider sitting on a high stool while preparing food. Bedroom adjustments. Adjust bed height for easier entry and exit, not too high, not too low. Consider a firm mattress with good support. Use pillows strategically to support painful joints during sleep. Keep a lamp or light switch within easy reach of your bed. Assistive devices. Various tools and devices can help maintain independence and reduce joint stress. Mobility aids. Canes provide stability and reduce weight on painful hips or knees. Walkers offer more support than canes and can include seats for resting. Wheelchairs or scooters, for longer distances or during severe flare-ups. Joint support devices. Braces or splints provide external support to unstable or painful joints. Orthotic shoe inserts help align feet properly and reduce stress on ankles, knees, and hips. Compression garments may help reduce swelling in hands, knees, or ankles. Daily living aids. Reaching tools extend your reach without straining. Button hooks and zipper pulls make dressing easier with limited hand dexterity. Lever-style door handles, easier to operate than doorknobs. Key turners provide better leverage for turning keys. Pen grips make writing more comfortable with arthritic hands. Managing pain at home. Several strategies can help you manage joint pain between medical visits. Heat and cold therapy. Heat therapy relaxes muscles and increases blood flow. Warm showers or baths, especially in the morning to reduce stiffness. Heating pads or microwavable heat packs, 20 minutes at a time. Warm paraffin wax treatments for hands and feet. Cold therapy reduces inflammation and numbs pain. Ice packs or frozen gel packs, 15 to 20 minutes at a time. Cooling gels or sprays. Cold compression wraps. Comfortable positions. Use pillows to support painful joints while sitting or lying down. Change positions frequently to avoid stiffness. Consider an ergonomic chair with good lumbar support. Use footrests to elevate legs when sitting. Gentle self-massage. Use circular motions around, not directly on, painful joints. Apply lotion or oil to reduce friction. Consider tools like massage rollers or gentle massagers. These home strategies can significantly improve your ability to manage joint conditions day to day. Remember that small changes can make a big difference in reducing pain and maintaining independence. In our next section, we'll discuss how to develop a comprehensive management plan by working with your healthcare team. Part 6: Developing a comprehensive management plan. Having explored various strategies for managing joint conditions, let's discuss how to bring everything together into a comprehensive plan that works for you. Effective management requires collaboration with healthcare professionals and a personalized approach. Working with your healthcare team. Developing a strong partnership with your healthcare providers is essential for effectively managing joint conditions. Building your care team. Primary care physician, often the first point of contact and coordinator of care. Rheumatologist, specialist in diagnosing and treating arthritis and other joint conditions. Orthopedic specialist, expert in surgical and non-surgical treatment of musculoskeletal conditions. Physical therapist, helps improve mobility, strength, and function. Occupational therapist, provides strategies for performing daily activities with less pain. Nutritionist/dietitian, offers guidance on dietary approaches for joint health. Mental health professional, helps address the psychological aspects of chronic pain. Maximizing your medical appointments. Prepare a list of questions and concerns before your visit. Track your symptoms using a journal or smartphone app. Bring a complete list of medications and supplements. Consider bringing a family member or friend for support. Take notes or ask if you can record important instructions. Early diagnosis and following a treatment plan is the best approach to slow disease progression and optimize function. Self-care is a crucial component of managing any joint condition, and working with your healthcare team can help you develop the skills needed to successfully manage your symptoms day to day. Setting realistic goals. Creating meaningful, achievable goals is key to maintaining motivation and measuring progress. SMART goal framework. Specific, define exactly what you want to accomplish. Measurable, include concrete ways to track progress. Achievable, set goals that are challenging but possible. Relevant, choose goals that matter to you personally. Time-bound, set deadlines to maintain focus. Examples of effective goals. I will walk for 10 minutes, 3 days per week for the next month. I will prepare meals using anti-inflammatory ingredients 5 days per week. I will perform my prescribed home exercises every morning and evening. I will use proper joint protection techniques when gardening to avoid pain flares. Tracking progress. Keep a journal of activities, pain levels, and medications. Use smartphone apps designed for health tracking. Take periodic assessments of your function and pain levels. Celebrate improvements, no matter how small. Adjust goals as needed based on your progress. Remember that managing joint conditions is a marathon, not a sprint. There will be good days and challenging days. By setting realistic expectations and focusing on gradual improvement, you can make meaningful progress over time. A comprehensive management approach that combines medical treatments, lifestyle modifications, home adaptations, and ongoing monitoring will give you the best chance of maintaining mobility and quality of life. With the right support and strategies, many people with joint conditions can continue to lead active, fulfilling lives. Conclusion. As we come to the end of our discussion on managing joint conditions in older adults, let's summarize the key points we've covered today. Joint conditions like osteoarthritis, rheumatoid arthritis, and gout affect millions of older Americans, with more than half of adults over 75 experiencing some form of arthritis. While these conditions can significantly impact quality of life, they don't have to define your later years. Effective management requires a multifaceted approach. Stay active with appropriate exercise that strengthens muscles around affected joints without causing additional stress. Maintain a healthy weight to reduce pressure on weight-bearing joints. Follow an anti-inflammatory diet rich in fruits, vegetables, and omega-3 fatty acids. Get adequate rest and quality sleep to help your body recover and reduce pain. Consider appropriate medications in consultation with your healthcare provider. Explore advanced treatments when necessary, including injections or surgical options. Adapt your home environment to reduce joint strain and prevent falls. Use assistive devices that help maintain independence. Work closely with your healthcare team to develop and adjust your management plan. Remember what Dr. Brett Smith, a rheumatologist, emphasized: pain is more common as we age, but not necessarily a fact of life. With proper management strategies, many people with joint conditions can maintain their independence and continue enjoying their favorite activities. Each person's experience with joint conditions is unique, so it's important to work with healthcare professionals to develop a personalized approach that addresses your specific needs. Be patient with yourself and celebrate small victories along the way. Thank you for watching this video. We hope you found this information helpful in your journey toward better joint health. If you have questions or would like to share your own experiences with managing joint conditions, please leave a comment below. Don't forget to subscribe to our channel for more videos on healthy aging. Until next time, take care of those joints, and remember, staying active and engaged is one of the best medicines for both body and mind.